school, we are your nurses. Your lab results came back and show that you have high cholesterol levels. Your doctor prescribed you niacin and rosuvastatin to help lower your cholesterol levels. Have you heard of these drugs before?
No, I haven't.
Okay. Well, rosuvastatin is a competitive inhibitor of the HMG-CoA reductase enzyme that acts to lower your total cholesterol, dyslipidemia, which are low-density lipoproteins, and triglycerides. It also helps prevent cardiovascular events.
Wow, really?
Yes, rosuvastatin is given as an oral tablet, and dosages range between 5 and 40 milligrams. You will take 1 tablet daily with or without food. It is also important that you go on a lipid-lowering diet, so avoid foods that are high in cholesterol. There are some adverse side effects that may occur while taking rosuvastatin. Although uncommon, you may experience headaches, nausea, constipation, rashes, loss of strength and energy, and other GI disturbances. In addition, since you are taking niacin as well, which we'll be explaining a little bit, there is an increase of developing a more rare adverse effect called myopathy, which is a muscular disease resulting in muscular weakness.
Okay, so niacin, or nicotinic acid, is used to inhibit the production of VLDLs, which in turn decrease LDLs, and also decrease triglycerides, in addition to increasing HDL cholesterol. Niacin, also taken in large doses, as you will be taking it, it inhibits the release of fatty acids from the adipose tissue and decreases lipoproteins, in addition to causing peripheral vasodilation. Niacin is normally administered orally, and the doctor has prescribed the immediate release for your condition. So with the immediate release form, you will be taking this 3 times a day for 100 milligrams per day, which can be increased to 1,000 milligrams per day, but never exceeding 45 milligrams a day. Some adverse effects that you should watch out for is extreme facial flushing and facial itching. In order to combat this specific adverse effect, you want to consume aspirin, 325 milligrams of aspirin, 30 minutes before you ingest the niacin. You may also experience vomiting or nausea. And since niacin is a hepatotoxic drug, it may cause severe liver damage. So throughout your time taking niacin, we will be doing routine liver function tests. So are you clear with that?
I am. Thank you for all that information.
You're welcome. We will see you at your next appointment to check on your cholesterol levels and other lab results to see how the medications are working and to assess to see if further action is needed.
Okay, great. Where did you guys go to school, by the way?
UCLA.
Oh, I should have gone there.
Okay, have a good day.
Thank you.
Hi guys, coffee break.
Hi.
How are you?
Good, how are you?
Good. How's your day going?
It's okay, it's been tough.
It's okay.
How are your patients today?
Good. A lot of medication, right?
Yeah.
Cardiac floor.
What's one of the medications you gave?
Well, I gave Amlodopine to one of the patients this morning, and he kind of reminded me of my dad. He's a 65-year-old man, and he's had hypertension for the past couple of months. Right. And his daughter came in and said that she's worried about his chest pain also. He gets angina after walking up the stairs or even after a simple activity like taking the dog out for a walk. So she's worried, as I would be, as his daughter. But as a nurse, I wasn't that surprised because I know that he has atherosclerosis. Doesn't everybody have atherosclerosis these days?
Yeah, sounds like it.
Yeah, so he's been on a cholesterol-lowering medication for quite some time, but finally this morning the doctor prescribed him some Amlodopine, which is a blood pressure lowering drug. So I'm glad that he finally got that.
How does that one work?
Well, Amlodopine, think of it as the goalkeeper on a soccer team, or think of it as the gatekeeper. It's a calcium channel blocker. So Amlodopine will attach to the calcium channel receptors and block calcium ions from entering the muscle cells. So typically it works mainly on vascular smooth muscles and then some on cardiac muscles. So what it does, it blocks the calcium ions from entering the cells, so the result is relaxation of the muscles. And so instead of constricting, it's vasodilation. And so there's more blood flow, decreasing blood pressure, and also it provides more oxygen through blood to the heart, alleviating angina.
Are there any serious
Flushing is one common side effect, as well as palpitations and peripheral edema.
That's interesting. I had a patient today, 61-year-old male, who came in with hypertension and atrial dysrhythmia, and I gave him a calcium channel blocker too. The name of it is Dilitiazem, and it also prevents the cellular uptake of calcium, and it leads to a decrease in force of contraction in the heart, so it causes vasodilation, just like Jennifer's drug. But it should be used very cautiously in patients who are also taking beta blockers and nitroglycerin. Side effects do include dizziness, headaches. Constipation is a big one because the calcium channel blockers also block the calcium in the intestines. So the patients do end up with constipation, nervousness, facial flushing, and edema. Also very similar.
Yeah. Calcium channel blockers. Okay.
Yeah. What was your day like?
It was good. A lot of people have high cholesterol these days, so I gave my patient Lipitor to lower his cholesterol. And that works by blocking an enzyme in the liver that is involved with production of cholesterol. So his overall serum levels will decrease.
Good.
And simultaneously, it stimulates the receptors, cholesterol uptake receptors, to uptake more. So it's kind of a double win. So he is less cholesterol in his blood.
Okay. Sounds like a great drug, but I'm sure there's some side effects.
There are, similarly to yours, constipation and nausea. Also, a lot of people I've given it to complain of muscle weakness or muscle pain.
Okay.
So that's something common as well.
Okay. But it's worth the risk of some adverse effects to lower that cholesterol.
Yes. Also, grapefruit juice. Grapefruit juice or grapefruit itself or supplements can cause serious side effects such as rhabdomyolysis. So
My medication too, amlodipine, I instructed the patient to not take too much grapefruit juice because it could inhibit the metabolism of the drug. And so I also made a note in my chart to make sure with the doctor that we don't prescribe any CYP3A4 inhibitors in the future.
Same here. Same with my drug. Yeah.
How about yours?
No, but I had a patient come in with an extremely high blood pressure,
Okay.
and not only did she have a family history of high blood pressure, but she loved eating salty food and she was always stressed at work. And so the doctor prescribed her Lisinopril, and hopefully this ACE inhibitor will work by blocking the conversion of angiotensin 1 to angiotensin 2. And I told her to start by taking 10 milligrams per day, and depending on how she reacts to it, we'll keep a maintenance dose of 20 to 40 milligrams. But I'm going to make sure that she doesn't exceed 80 milligrams per day. What about you guys? Are there any limits to your dosage?
mine starts at about 10 and can go up to 80 depending on the condition. But since my patient is just taking it prophylactically, they started him around 20 milligrams.
Okay.
So kind of low.
Mine, amlodipine starts at 5 milligrams orally, just once a day. So that's pretty typical for an initial dosage. How about yours? Because it's a calcium channel
Right.
blocker also.
Mine, diltiazem, we start with 60 milligrams in the form of extended release tablets, and the patient, we remind them that they can't crush or break the tablets, or 30 milligrams 3 to 4 times a day.
Okay.
So,
Now, what are the side effects to your drug?
Yeah,
What is
so Lisinopril.
Right.
So my drug could lead to hypotension, hyperkalemia, and diarrhea. And another common side effect is dry cough, which might make her want to discontinue the medication.
Uncomfortable,
thing.
you know. Side effects are not fun, but I'm glad that there are these kind of drugs available to give to our patients to at least provide relief and even long-term effects. You know, and that's why we need to just make sure the next time we see our patients, we really follow up on those adverse effects and see if we could address them also.
You know what I was thinking? Good thing we paid attention to Dr. Soko's
Yes.
class.
Yes. Oh my goodness.
Remember that drug video we had to do?
Totally.
Yeah, remember
Totally
that long list of drugs?
Oh, I know.
Isn't it so
Yes.
great that we took the time to memorize
Seems so
all
small
of them?
now. Yeah.
Because we were able to really easily give those drugs and teach the patient, provide patient education
Yes.
about how the drugs work in their body, what type of effects, adverse effects to expect. And so I don't know about you guys, but I feel like I really built good rapport with my patients, and I really felt the patient's trust.
So how should we reward ourselves?
Well, I saw some donuts over there.
Donuts.
Yeah.
Let's
go.
That's okay.